Okay, let's dive right in. What does the future of healthcare in Africa actually look like? And look, we can forget all the speculation because today we're going to follow the data, the real world demand signals, to see exactly what the system itself is telling us. So, where are we getting all this from? Well, our entire analysis is based on data from one place, AfriFarm Health. They've gathered this really unique data set that gives us a ground level view of the real needs and pressures inside the system. All right, so let's kick things off by framing the core argument here, because it really challenges a super common narrative you hear about healthcare on the continent. I mean, that is a really powerful statement, right? It just completely flips the script. The conversation suddenly isn't about a lack of new ideas or brilliant apps. It's about the fundamental wiring that's just missing underneath it all. But that's the big question, isn't it? Infrastructure. It's this big, kind of abstract concept. So, how do we make that tangible? What does this problem actually look like for the doctors, the nurses, and the pharmacists on the front lines every day? Well, the answer, it turns out, is to just stop guessing and start listening. By tracking what healthcare providers are actively asking for, we can follow these signals and literally let the demand itself map out the biggest gaps in the system. And we're not talking about a small sample size here. We're looking at over 2,092 distinct signals of interest. That's a huge amount of data showing real intent from providers who are actually on the ground. And get this, these signals are coming from 20 different countries. So this isn't just one country's story. It points to a pattern that's stretching all the way across the continent, highlighting a shared, deep-seated challenge. Okay, so what are these providers actually saying? What do they want? Well, hospitals, they're not begging for another shiny new app. They need better coordination. Pharmacies feel totally isolated. They want to be part of a patient's continuous care journey. And home care providers, man, they're asking for the absolute basics, trust, safety, and a simple guarantee that they'll get paid for their work. This isn't about fancy tech. It's about fundamental human needs. So what happens when you pull all these individual requests together? This is where the numbers start to tell a really, really compelling story. Okay, first big revelation, the demand, it's not spread out evenly at all. Nearly a third, 31.5% of all that interest from 20 countries is clustered in just 4: Kenya, South Africa, Zambia, and Ghana. That's a massive concentration. And you can see it right here, plain as day. That big slice of the pie shows us exactly where the pressure in the system is just off the charts. These countries are the hotspots, and they're signaling a critical need for a solution right now. Now, here's where it gets really, really interesting. Let's look at the breakdown within those hotspots. Would you look at that? Home care is the single strongest signal by a mile. It is dwarfing everything else. This isn't just some minor need. This is the system literally screaming about where the real gaps are. But it gets even more nuanced. The data shows us that there isn't one single African market. In a place like Kenya, for instance, the demand is very digital first, focused on virtual care and home care. But then you look at Zambia and Ghana, and the primary need is for continuity, connecting pharmacies and home care to support patients after they leave the hospital. Different markets, different infrastructure needs. Okay, so if the problem is a massive lack of infrastructure, what does the solution even look like? How do you go about building that missing layer that everyone seems to be asking for? Well, the solution is something called digital health infrastructure. And I absolutely love this analogy of rails. See, it's not about building one giant centralized hospital system. No. It's about laying down the tracks that allow all these independent providers, payment systems, and data to connect and move smoothly between each other. And here's how those rails actually work in the real world. They connect 5 distinct but interconnected networks. You've got one for hospitals to improve coordination, one for pharmacies to create that continuity of care, one for home care to build trust, and a networks for virtual care and emergency services. The key is each part stays independent, but the infrastructure, the rails, lets them all talk to each other, coordinate care, and handle payments seamlessly. And this brings us to such a critical distinction. An app is just a destination. Infrastructure, that's the road that connects all the destinations. Trying to fix a huge system-wide coordination problem with a single app is like trying to fix citywide traffic by just designing a better car. It doesn't work. You have to fix the roads. All right, let's wrap this up by looking ahead. Why is this infrastructure first approach so incredibly vital for what's coming next, especially for all the exciting new tech we see on the horizon? And this, right here, is the key takeaway for the future. You can't just sprinkle some AI onto a fragmented, broken system and expect magic to happen. It doesn't work that way. Artificial intelligence needs clean data, it needs verified providers, it needs reliable payment systems. Simply put, it needs functioning infrastructure to scale effectively. You absolutely have to build the foundation first. So, what does this all mean? What's the bottom line? The data is telling us a crystal clear story. The future of healthcare in Africa. It's not going to be decided by who builds the fanciest app. No, it's going to be decided by who successfully builds the shared digital rails that finally connect the entire ecosystem.